Hey sweetheart. Hi, my name is Dr. Kevas. Yes, and today we are going to conduct several tests on you. Is that alright? Perfect. Great to hear that. There will be no particular tests that I have prepared. I'm going to ask you several questions, and based on your answers, we will conduct several tests, okay? So I wanted to ask, I'm going to ask about your family history, about your current health, and so on. Maybe proceed? Perfect. So I'm going to first ask you to confirm your name. So can you tell me your name? Okay. Perfect. Then I will ask you what date and time do you think it is today, at this present moment? Good. And can you tell me how you are feeling? Okay. Do you have any kind of trouble with your eyesight lately? It's hard for you to see into distance? Okay. So we struggle with distance. Good. Your hearing is fine, or do you struggle to understand when someone is having a conversation with you? Perfect. Does that happen often? No, just in busy restaurants. Okay. So this probably happens when there's a lot of people around you, right? And there is like a lot of noise. Does it bother you a lot? Okay. Perfect. Thank you. I'm going to ask you about your family history. Okay. So your family, was it your mother? Okay. Your mother has a problem with, okay, thrombosis. Have you got yourself a test of your blood if you have Leiden syndrome or not? Okay, you don't. That's great. Perfect. Have you had any vaccination lately? Alright, no judging here. That's perfectly fine. Great. Okay. Have you ever had any kind of surgeries? Okay. Any broken bones? Okay. Great. Perfect. Are you on any meds at this current point at the time? Okay. And is it long term? Any heart diseases? Do you sometimes find yourself having a heart arrhythmia? Okay. Alright. That's great. Thank you for answering all of my questions. I also wanted to ask about your mental health. Since it's currently January, it sometimes happens that people actually do not feel that fresh and also very happy because we do not go out as much. Still, there is a corona outside, right? And also we do not get the vitamin D from the sun, so we tend to feel a little bit sad from time to time. Are you all right? Okay. It really helps if you move around a little bit. You don't have to exercise for an hour, but it's really great if you do something like a little stretch for 15 to 20 minutes every day. It's really beneficial. Yeah, especially if you sit a lot in your work. By the way, what is the work that you do? Okay, that's interesting. Okay, yeah, I've always have been a doctor. Yeah, great. So now that we got this, okay, we are going to conduct an eye test. Okay, perfect. Also, I'm going to check your ears. Good. That's perfect. So first off, we are going to try I wanted to do a visual acuity, but the problem is that our chart got kind of messed up. So if you want to, we can try it like reading mirrored. So can you tell me what this letter is? Yes, that is correct. It's E. Can you tell me what this letter is? That's M. That is correct. What is this letter? Yes, that's I. What is this letter? O. Perfect. And this? H. This? C. Perfect. So we've got E, M, Y, O, C, H. Good. I'm going to take my light, my horoscope, and I'm just going to shine a little bit into your eyes, and I'm going to watch your pupils. Perfect. If they constrict and dilate, perfect. Now here, good. So the pupils are actually intact. Good. Good. So the left eye of yours is pretty much good. Now the right one. I'm going to shine from the bottom. Good. Now from up. 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 Oh, down. And down. Perfect. Now I'm just going to look if when I shine the light into your left eye, if the right eye is also going to constrict its pupil, okay? Perfect. Now the other eye. Perfect. So both of the pupils are intact. Now I'm just going to go really close to you, and I'm going to look at the back of your eye. So if you just look in front of you, yes, you can watch the hand in the behind. Okay, so let me just look. I'm looking behind the pupil, and everything seems to be just fine. Everything seems to be perfect. Now the other one. Good. Okay, I can see that there is some vessels that have ruptured, but that's alright. Have you possibly been staring into a computer or screen for extended period of time? How often do you look into some kind of source of light that is unnatural? Yeah, that might be a problem. That could actually cause the problems with your eyes. We're going to try this test. I'm going to move my fingers. I'm going to move my fingers, and you will tell me when you will stop seeing them, okay? Stop perfect. Stop perfect. Stop perfect. Perfect. Good. Perfect. Great. Now you are going to focus at my finger. And now look on the hand in the behind. At my finger. And the hand in the behind. Right there. Good. Perfect. Yes. Now watch my finger getting close to you. Now watch it again. Now watch it from side to side. From side to side. Any double vision? Yeah, a little bit. Alright. And where it was? We will try it again. We will try it again. Tell me when you see the double vision. Okay. Okay. Yeah. 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 Okay. Perfect. Now we will try cover one of your eyes and I will show you something, okay? Which color is this pen? Okay, red. We'll cover your other eye. Which color is this pen? Red. Is it the same? Okay, perfect. Now we will try. I'm again going to cover your eye, okay? Like this. What color is this pen? What color is this pen? Is it the same? Nope, it's not. Perfect. Perfect. So it seems good. Now let me just cover your other eye. And what color is this pen? Yes, it's red. Good. And what color is this light? Yes, it's deep blue. Perfect. So it seems like that's good. Okay, now we will try some shapes, okay? What is this shape? What is this particular shape? What is it? It's heart, correct. That is a human pulsating heart. Perfect. Good. What is this? What is it? Okay. Perfect. It indeed is a brush. A brush. Yeah. It is a brush. Now, can you tell me what this is? Yes. Yes. Correct. Correct. Perfect. Can you read those numbers on it? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Perfect. You've done a great job. Good. Good. Now I'm going to lift your lid up. Okay, and could you please look up for me? Perfect. Now look up with the other eye. I'm going to just lift the lid up. Good. Now look down. Perfect. Perfect. Great. 5 centimeters long, and the other one 1, 2, 3, 4, 5 centimeters long. Perfect. Perfect. We are going to grab some gloves, and I'm just going to look at your ears. Okay, let me just look at your ear. That's perfect. Let me just touch your helix. The anti-helix. Tell me if anything is painful, okay? The helix, the anti-helix, the mastoid lobule. Nothing that would hurt. Perfect. Now the other side. Good, great. Okay, lobule, mastoid, helix, and anti-helix. Okay, just going to take my otoscope. Keep my finger light on your face, laying on your face, and I'm going to look in. I'm getting past the hair. And can see that you have there some earwax. Nothing really that dangerous that should cause you any kind of problems with your hearing. On the other side. Okay. I'm just going to take it into my other hand and look into the ears of your heart. Perfect, good. Okay. Everything seems to be fine. Your ears are not in need of to be cleaned. However, I will actually send you to a doctor that really specializes on problems with hearings, because it can happen that you will have a degenerative hearing loss, which is kind of normal with age. Yeah, not very often at young people. Depends if you really listen to your music too loud, if you work in a loud environment, for example at constructions, and so on. Yeah, perfect. Okay, I'm just going to quickly look at your skin on the face, and I do not see any rash, a little bit of redness. Your skin is really prone to redness. You have a little bit of troubles with the acne. That's kind of normal. I would actually recommend you to use natural products, not touching your face too often, using oils when you clean your face, even from makeup. Yeah, this really help. Actually, I prefer these more than from what you will get from dermatologist doctors. Yeah, I know that I shouldn't be telling you that since I'm a doctor myself, but this is just my personal experience, that the natural products actually work better than the ones that are very invasive to your skin, and they dry the acne. These really don't help that much, I would say. As I said, this is my personal experience, and if you want to look a dermatologist, you definitely can, but I think it's not really necessary. Also, it can reflect your hormonal changes or any kind of stress. Yeah, there's usually breakdown, for example, before periods, when the hormonal alcohol levels change. Yeah, and the stress is also a great factor. Also, food. Refined sugars will never be great. Well, so that's about that. And I think everything else seems to be fine. Your skin is perfectly good. And yeah. Do you want to share anything else with me today? No. Okay. So if you find anything that you would like to discuss, definitely call in. Yeah. Have an appointment and come and I will see you again. Perfect. Well, thank you. Yeah. Well, it was very nice to meet you again. And yeah, hopefully everything will sort out with time. Perfect. Thank you. Bye.